will join us or not. But okay.
Okay.
So this is our third call. So far, let's see, we had pretty good outcomes from the couple consulting things that you've done outside of PAC.
Yeah.
How's that going? Because I know you said you would potentially have another meeting.
I do. In fact, she said, this is a lady who I've known for a while, and I see her at various events with her husband. And she's been really frustrated with a few things. And I said, would you mind if we set up a phone call that I could record? Because she directly laid out two major issues she's having. One with him, they don't know how to get him engaged in the daytime.
Sure.
And just her frustration that what she's seen, the changes she's seeing, that he can't talk or do a lot of things for himself. So that's an emotional issue for her. And then it's a sort of, I think it'll be a great way to talk through what's most important to her to look at for now.
So you are setting up a Zoom
phone call.
Nice.
A phone call with her. I'm going to, the only thing is, I'm not sure if she's going to be able to use Zoom, so I can record it. If not, I will just try and figure out. I don't know if you have any resources for other ways to record.
Well, with Zoom, they can always just call in. I mean, it doesn't have to be a video.
Oh, they have a call-in number?
Yeah, so if you scroll down in the email below where you click the link normally,
yeah,
right below that, there's just a phone number that you can.
Excellent. I didn't know that. Okay.
Yeah, as long as she has the meeting ID number,
right,
9 or 10-digit number,
right,
and she calls it's like an 800 or a, let's see.
I'll find it. I'll figure it out. You know what? I'll call, if Zoom is good with support, so I can get.
Yeah, but it's just down there at the bottom of the email, so.
Okay. I've never looked for it, so.
Yeah, if you've never needed it, then you've never tried to find it, but it does exist. So then you can still record, even though it'll just show up as her as a little phone.
Excellent. I think that's great. So
cool. Yeah. Okay.
Yeah.
So what's your goal for that next meeting? What's your personal goal?
For the next meeting with her?
With her. Mm-hmm. Because it sounds like you know the two issues. So what are you thinking as far as explore options, possibilities of puzzle pieces? What kinds of things are you going to?
Well, I think it's going to be really important for him, and I am coming in with some information myself, actually.
Right.
I think it's really going to be important to explore the person, to find out more about who he was, what his likes and dislikes were, and what his activities were, the kind of, was he more introvert or extrovert, or, things like that may not be obvious anymore. And then probably.
And is that for you or for her to kind of see and remember and start to think of?
I think it's for both of us to identify, because if she's saying they're having trouble getting him to do anything in the home during the day, let's figure out what he can do that might have been something, or how we might be able to tease out something that he used to do.
Connected to something.
His abilities now.
Nice. And does she know Hand Under Hand or PPA at all?
She has seen it, and she says she got training. I think she went to the Alzheimer's Association, but to be honest with you, I'm not so sure.
You would probably need to coach it through again if there was going to be any use of it. Okay.
Yeah, and even I was thinking too, that's another thing, is even working with her to get her care people up to speed.
Yeah, definitely. I mean, you can use your trainer and your coach skill for that. Right. So cool. Okay.
Yeah. So I'm thinking that we examine kind of basically looking at, she wants him to be engaged, but I think it's also important to start checking the balance of the day too.
Yeah, looking for that cycle of
when it's meaningful activity, when it's joyous activity, when
it's just a restful,
Yeah,
so looking at probably the time card is the other.
Yeah, that's what I was just going to say.
Okay.
And the time are probably the two most important things to explore.
So looking at the cycle of the day and kind of balancing activities.
Yeah.
Nice. Okay, cool. So it sounds like you've got a plan of action, at least to start with. That's
Well,
exciting.
where I think it should go, and of course the whole thing is I don't know where it's going to go.
You never
By
know,
the time
right?
we talk, she might be want to talk about something else. So
Right. And that's okay. But at least you have an idea of what you need information wise to kind of make some next steps and offer some explore options, because you don't know until you know more about who he was and what he liked to do. So good.
Yeah.
Cool. And then let's see, it sounded like you also had some success with an initial contact.
I did.
From PAX. So talk to me a little bit about that. How'd that go?
It's kind of interesting, and it's going to be a challenge.
Mm-hmm.
This is a lady who is she's going through major transitions right now. She's retiring from New York City school teacher she's retiring this next week. And her husband was just diagnosed with mild cognitive impairment. She is convinced, however, she says, I'm a constant researcher. I could be a professional researcher. So she is convinced that he has early parts of Alzheimer's disease or some form of dementia. When I sort of checked in with sort of what she was noticing in shifts, the only thing that really seemed to be clear maybe is short-term memory loss. He still can be at home. He still can take care of himself. He still is very active. He goes to karate every day. She's not afraid to leave him alone. He's able to get to and from places. But she wants to get herself set up for the future.
Okay. And
take care of herself.
Yeah.
And part of that is she said she doesn't feel that any of the support systems in the city work for her, and she thinks they're lacking, whereas she thinks the positive approach is the way to go. She believes it.
Okay.
She is inspired by TIPA and the different approach, and feels she wants support from our perspective.
Gotcha. So
we set up for her for the next time. She's going to wait till July because she wants to just get retired and just take a little break, and then come July, we decided that she was going to get some DVDs and start doing, instead of just getting the little snippets online that she's been getting, that it might be helpful. I did tell her about accepting the challenge, which is kind of a nice starting place, but if she wanted more to understand the language that I might be using with her, so we can really start working on together.
Sure. And one thing to really think about is, history and duration, onset. These might be things that have always been a concern or always been around.
Yeah.
They're just more noticeable now.
Yeah.
Usually, I know that there's a really good check sheet, sort of, not a literal check sheet that you can go through, but with the normal, not normal aging, there is that sort of list of things to really look for and what the real difference is, so you can use your trainer background to kind of normal, but short-term, what we term short-term memory, which is really working memory.
Right.
That does struggle as we age. So is this a change that's drastic and sudden? Is it something that's been going on for a long time? Thinking about behavior also, is there something that he's doing, or are there lots of things that he's doing behaviorally that are really different than what he did in the past?
Yeah, I was
asking those kinds of questions to kind of tease out, is there really something else to be concerned about, or is this, over concerned because there is this new change in brain?
Yeah. Well, I actually yesterday, when I was with TIPA at that meeting, she brought up the 88 screening.
Right, and the animal fluency.
It's just those 8 questions kind of address, have you noticed a shift in this? What's different than it used to be? And it really just takes you right through it. So I think that actually might be a really good thing to do with her.
Well, that one, the animal fluency test that she also talks about, where you just give them a minute and they just list as many animals as they can.
No, I meant because the 88 is actually an interview for the loved ones.
Yeah, so the animal fluency is anyone can do it
right
any time. So it's another good one to kind of if she's looking for some baselines,
That's good.
and the animal fluency, because she's going to take a break, from all of this.
Yeah.
If she could, though, do just a 1-minute quick animal fluency test, basically you can look and see how many did he list and kind of how's he listing them. Is it going, cow, pig, chicken, duck, things that would be on a farm.
Right, and then
switching up, or is it bat, cat, rat? Is it going into rhythm and rhyme rather than, so just kind of feeling it out, getting a baseline now and then possibly getting another in a month or in 2 weeks or in 2 months.
To see if things are really,
because that can give her a better sense of how things are changing and how quickly things are changing.
Right.
Because if there's not a whole lot going on, then, that can give her an idea too of where to really be concerned and where to not be concerned.
Right. And she is really angry. She is so angry.
Yeah, it can be really frustrating.
Yeah, she even said, I can't love my husband.
Right.
So that's going to be another piece, is teasing out what's really him and what's happening to his brain.
Yeah, exactly. So yeah, cool. It sounds like you've got some next steps, but that one's kind of on a back burner for now, which is nice as well. Give yourself a little break and get time.
I have plenty going on.
Do you? Are you sure? All right. So as a PAC consultant, you were hoping to really work to make sure that you got the person's biggest goals or concerns out first.
Yeah.
And then not suggesting anything, really trying to find out what information you needed, which puzzle piece to dig into, so that they could help you come up with what they wanted to try first, their explore.
Very tricky.
Yeah. So
and I'm working on my questions instead of the suggestion with my questions.
Your questions instead. And so you came up with your cheat sheet to kind of help you along in that. When you feel like saying, here's an idea, you're going to ask one of your cheat sheet questions that will help you out.
Yep.
Cool. So the only piece that we didn't really do was the video of your PPA, but
shoot, I'm sorry.
We can do that. No, it's no problem. We can do it next time. It's just a 30-second video of
me.
So, but you did choose scenario number 8.
Yes, I did.
So we're gonna try.
It looks a little scary to me, and that's why I picked it.
There's a lot of. It's funny because it's the one with the most information, but it's also the one with the most possibilities of what the heck is going on here.
Yeah. So many angles to approach and what's most important.
So are you still working towards the characteristic of staying curious, or is there another one that you feel like you've kind of shifted to, or is that still your first focus?
I still think for me to stay curious is really important.
Okay.
Because I know that my brain already goes to, I know what the real problem is and here's what we're going to do.
Gotcha.
I'm trying to keep myself back from coming into it already. I saw myself do that. I was like, oh, here's what we're going to do. This is what I'm going to sort of hope we can get to. But that may not. I have to allow myself to allow it to emerge.
Right. Because it'll in the end be a better answer, but it's so hard to know that when you're going into it.
Yeah.
Okay, so for
I don't know who the person is who I will be speaking with.
Exactly. And you don't know what might come out when you ask a question. It's like, whoa, wow, that was a big one.
Yeah.
Okay, so now for the consultants used on this sheet, you had chosen active listening and responsive behavior. But it sounded like the last time that you were actually interested in kind of shifting more into the puzzle pieces and how you use them.
Yeah, I think so.
What do you feel about that?
I think I really want to embrace these as tools to help me and to really make sure I'm not just skimming through them, that I'm really digging in with the options of each piece.
Awesome. Okay, so
and not just a quick glance, like really I need to take more time for me too.
Okay, so really trying to use the tools, the puzzle pieces, or your cheat sheet, rather than focusing on something that's sort of
in my head.
Yes, something that's active listening. That kind of goes with curious, and if you're really being curious, then I would say pick one that's a little more concrete, which it feels like the tools and your cheat sheet is something that's a little more concrete to hold on to.
Yeah.
All right, cool. So I'll be kind of listening for that and see how that goes as you check it out. So who would you like me to be?
Well, I was going to ask you actually, if we're trying to kind of play a scenario that really could exist, if it isn't really true anyway, who would have sent that, let's say, email or made that request, do you think?
So here's what I would imagine happening in this scenario, given that she is currently in a facility.
Yeah.
It would either be the head of nursing or the head of whatever who's in charge of this group, who's bringing you in to say, what the heck do we do? We're at a standstill. Or it would be the daughter who is coming in every now and then trying to figure things out, but then having to leave again. So those would be sort of the two options, is someone who's in charge at the facility or the daughter. For realistic sake.
Yeah. That's what I figured. I'm wondering if it might be helpful for me, since we did a child of a person living with dementia last time, if we should maybe have you be the someone in the facility.
Absolutely. Yep. So my knowledge will be fairly limited as to the whole backstory.
You would have had this information that I have?
I would have this same information just because we both have it.
Oh, yeah, this is going to make it tricky for me now when I just think about it.
Yeah, but I think you're right. I think good practice to try something different, since we did do a family member last time.
Yeah, who had more information about who the person was.
Right. Okay, so we'll go ahead and get started if you're ready. Do you have all your things and pieces? I've got puzzle pieces and gems.
I got my gems, my personality, my consultant cycle, my cheat sheet, my pieces of the puzzle.
Is there anything else you want me to have out and available other than the gems and the puzzle pieces that you might use or reference?
Do you have your personality traits?
I do. Let me go grab them.
That might be helpful, maybe.
I'll have them here anyway, just in case.
Yeah, I'm just going to put them out if it looks like we can take that direction.
Okay, cool. All right, so I am calling you for assistance. You are a consultant that can come in and fix things for me.
Yeah.
My name is just Amanda. You can just call me Amanda. I don't have to be Mr. So-and-so. So, Catherine, this woman, I don't know what to do. This whole thing is out of control. We're stuck.
You feel out of control. You're stuck and out of control.
Yeah.
Well, tell me what's happening.
Well, to be honest, I don't have a lot of interaction, but I have to say everybody is fed up with her. Mm-hmm. This woman, her name is Frances.
Right.
She is, at this point, she basically is a recluse in her room and not coming out, not eating, not drinking. We're stuck.
Wow. Yeah. So you guys are feeling kind of like stuck. You don't know what to do about this person who's it sounds like she's isolating herself.
Yeah, and it's a real problem for us, because if the state comes in and sees that, then we're getting in trouble, and her daughter's coming in and saying that, and we're getting in trouble. So you know how it is with with all the regulations. I'm worried that we're going to have to move her.
Well, what have you been trying?
Well, we've been trying. The thing is, we were going in, you know, and getting her changed, it sounds like, and getting things happening, but now she doesn't really want anybody in her room. So people just can't even really get into the room without her throwing a hissy fit and going, yelling at everybody and crying and, you know.
So she really likes to be alone. She wants to be alone?
Yeah, she really doesn't want anybody in there, and it's her space, and, you know, she's just been pissed the whole time. As soon as she got there, she got really angry.
Right. Well, let's talk more, if you don't mind pulling out your stakeholders card. I'm wondering if that might be a nice place to explore sort of what you guys know or...
Okay.
So just tell me a little bit about maybe what you know about Frances that might be important.
Well, I mean, I know she's pretty young. I mean, compared to our other people that live there, all of our other clients are really probably a good 20 years older than her, or at least 10.
Wow. Do you know any? I'm sorry, go ahead.
So I think she's only 60.
Wow. So she's pretty young.
She's pretty young. She was living, I think, by herself. Her daughter, I don't think they saw each other very much, and now she comes in, you know, the fly-in daughter, fly-out.
Yeah.
Ticked because her mom, well, social services was called, and that's why she ended up here.
Oh, boy. So she's new.
Yeah, well, I mean, her daughter didn't know until social services was called, and they moved her. Right. They had to go, and, you know, it was a pretty bad intake.
Oh, does she have a diagnosis yet?
You know, no. There's clearly something going on, but we don't know exactly. I mean, we haven't gotten any specific diagnosis of any specific dementia or anything. But they were saying some could be schizophrenic or paranoid, or because she was, the night they went to get her, the police went to get her, she was seeing things, and, you know, she was really
hallucinating.
Sorry?
She's hallucinating?
Yeah, I don't know. I mean, they just said she was delusional.
Okay.
So I wasn't there, obviously, but I know it was a really bad intake, and she's really skinny. She hadn't really been eating a lot before, but now she's even tinier than she was. And I know she had a job until kind of recently.
Mm-hmm. Do you know what the job was?
Yeah, something about computer, you know, just...
Yeah, I saw that, and I actually saw something interesting about her working the night shift.
Yeah, you know, it seems like she's definitely more alert at night.
I was wondering about if there's a time of day, do you think that you have more challenges than another time of day?
Well, night, because it's our, you know, when you talk about the people around her, that's not our greatest staff, because we have smaller amounts there.
So you have less staff at night than you do during the day?
Yeah, because, you know, most people sleep. So we actually have...
Not sleeping?
No, she's barely sleeping at all, ever. You know, she'll just kind of sit there and stare out the window, but if anybody tries to go into her room, she throws a fit.
Does she have a better relationship, do you think, with the people in the morning or the people at night?
She really just doesn't like anybody.
No one's been really successful with her.
No.
So there's no relationship that she's formed with any particular care partner.
Yeah, no, even when her daughter comes in, I mean, she'll tolerate her, but she really doesn't want her in her space.
Oh, wow.
And she can't get her to do anything. You know, I know when they picked her up, she had like 10 dogs or something.
Oh, boy.
Something scary. So I know they weren't probably being taken care of.
Wow.
Knowing how she's taking care of herself. She was able to kind of do some stuff earlier on, you know, like changing her clothes and stuff and brushing her teeth, but now she's not doing anything.
I wonder if finding out or getting her seen to really get a hold on what her medical issues might be. What do you
Yeah,
think
if we
about
could get
that?
her out of the room, we just can't seem to get anybody. Nobody is allowed in. Can get her out.
So, what do you folks know about dementia?
I mean, we know a decent amount about, obviously, Alzheimer's. We have a bunch of people who have Alzheimer's. We have a couple who, have, I guess we've got two that have vascular, but they also have other health issues. I mean, they have a lot of health issues going on, high blood pressure, heart disease. They've had strokes. We have a few that just had strokes and don't have dementia. But this doesn't seem like the same. It doesn't seem like any of Alzheimer's or.
So this is different. This is different than what you've dealt with before.
Yeah, and my staff are just stuck. I mean, they don't know what to do.
Yeah.
I mean, there's times
you guys feel stuck.
Yeah, she says she's seeing things and
oh boy,
not sleeping. So then at night, she's, of course, hallucinating. She's not sleeping. So, and she's not eating. So.
So do you think, give me a second, I'm sorry. I'm thinking for a second. What I'm hearing is you're having some issues with her health in general and also with just getting connected.
Yeah, I mean, no one can seem to get in.
Which do you think is more important at this point to really try to focus on?
Well, we can't really do anything about her health until we can get into the room or.
Okay, that makes sense.
So I would say probably connection.
Deeper into what we might be able to do to make a connection with her so that somebody can get into the room and start helping her or just.
Yeah, because.
Sounds like getting connected in a personal way might be. How does that sound to you?
Yeah, I mean, I think that's what we've got to do. I just don't have any idea how to get there, Yeah,
I understand that it's hard to know what to do. So, we're going to stick with some of your staff here, if you don't mind. Is that okay? Talking about skills they might have when they approach folks who are resistant.
Well, they all have, we've done the PPA. They've got it with all of our other residents. They're good.
They do know PPA. They do.
They do. And they've been so successful. It's just this one, she really doesn't want anybody in her room or in her space. And if you bring something in, then you have to leave it there. You can't even take it out of the room. But she doesn't want any people in there. I mean, she just doesn't like people that much, it seems like to me.
So let's shift for a second. Maybe we can talk more about the environment, because maybe there's a reason she's staying in that room. And see if there's something in the environment maybe.
Well, she doesn't go outside. There's a door to go outside in her room, and she doesn't do that.
Right.
She doesn't like to leave.
What's outside of her room?
Well, there's a hallway, and then it goes down to it opens up into sort of the dining area, and then the living room, which is next to that, which there's comfortable couches and things, and she just doesn't
even. Has she ever been there?
I think on her way in the first time, and then she's pretty much, I mean, unless we walked her down there, which the first 2 days people were kind of able to, but now she doesn't want to leave at all. She just threatens to call the police or call her daughter, and so.
All right. Well, I'm just wondering what she's seeing when she looks out the door. If that might be something that's maybe if she's scared or.
Yeah, I don't know. She spends a lot of time just kind of staring out the window, but she has her chair so that she can see the window and the door. Where she lived was pretty much out in the middle of nowhere. And like I said, she had those 10 dogs. And
so she was used to being outside, I guess, a lot.
I don't know if she was outside, but she was used to not a lot of people, I guess, and being where she could see, nature, which at our facility, nature is not really, and like I said, with the dogs, I mean.
Is there anything that came with her that's personal?
Yeah, I mean, her daughter brought a few things that were from her house, but it sounds like she kind of just liked to have a few glasses of wine and hang out at night by herself and with her dogs, and that was it.
At night she was working, though.
Until recently, she hasn't been working for a while.
Oh, so she started drinking at night when she stopped working.
Yeah, probably more. I mean, I don't really know about that, but I know her daughter said that she would drink wine, and at the beginning, we don't offer wine, so not a lot we can do there. She would probably drink it if we had that, but she won't eat or drink anything else.
Oh, all right. I'm wondering if we go back to this, it might be an important piece is how her time is.
Okay.
If she was a night person, and that's when her brain was active when she was working, I wonder if we should explore if there might be, I know she doesn't allow people in the room right now, but somehow getting something for her to get her in a calmer state of mind so you could get connected with her.
Yeah, I mean, I don't know what we could do. It's sort of hard because, nobody can get into the room. Well, they can go in, but then she starts yelling and screaming at them, and so she's not really listening at that point.
I'm wondering how much are they meeting her at her level when she does outburst?
I don't know. Probably not. What do you mean by that?
Well, have you heard about, in the positive approach to care, have you heard about when you have a challenging behavior, that sometimes if you meet them, if you've tried a positive approach and they're not letting you get all the way in, but if you meet them at their level, you might be able, by sort of becoming an advocate and acknowledging what they're saying and what they're going through, you might be able to get them calmed down enough to finally be able to make a connection.
Like, I mean, she's pretty much yelling and angry every time.
You want to maybe role play with me and see what you might think about that?
Yeah, but wouldn't that just be like yelling at her?
Well, you want to try it? Can we just try it and see what you think?
Yeah, we could try that.
Okay. So if you don't mind, maybe you can just sort of be Frances, and if I'm a care partner, I'm going to come into the room. Let's say, how about, when is she most challenging? When does she really go off?
All the time now. We don't really have.
So just stepping into the room and saying hello can cause a.
Get out of here right now. Is what she always says. Get out of here right now.
Just if you want to role play with me, we'll see what happens. I thank you for trying. I appreciate that. Let's see what happens. If you just hey Frances, how are you?
Get out of my room. Get out of my room right now.
Get out of your room. You want me to get out of your room?
This is my room, and I'm calling the police.
You're right. This is your room. I see you want to call the police.
Yeah, I'm going to call the police if you don't get out of here.
All right, you want me to get out of here?
Yeah, get out of my room.
Get out of your room.
Yeah.
Yeah.
Oh, yeah, that does kind of calm you down a little bit.
Get out of your room.
Huh.
Yeah. How was that for you?
Yeah, that was different because I think mostly they just run out of her room.
Mm-hmm.
I know I would.
What was different about it for you?
Well, the thing that you did that was kind of interesting was you just said the same things I was saying, and so I didn't feel like I had to repeat it anymore. Because that's the thing she does a lot is just repeat, repeat, repeat.
Uh-huh.
Hmm.
Do you think this might be a technique you might be willing to try with some of your folks? Or
Yeah. I think that
would you like to try look at something else?
No, I think this is something that it might get them in the room, or it might at least let them stay there, because with PPA, they're pretty good about getting down.
Once they get connected, so.
But
good.
Should they, now would they do the normal, like try to get her hand? That doesn't seem like a good idea.
Well, it sounds like right now she's really protecting her personal, right? Her personal and her intimate space.
Mm-hmm.
So probably, at least when you approach, if she starts saying
even her public space in the room, yeah. So maybe we would just put a chair or something at the door, so that
you could get down. That's a great idea.
So they could be down, but they're really far from her and still really close to the door.
So she feels like she's not trapped.
Right, and so that they don't have to go too far into her room to start. Yeah, why don't we try that? And then, then maybe we could get a doctor in who could really assess, because whenever we bring someone in, it's just pointless because you're not getting anything from her.
Right, so getting her calmed down enough that you can get some assessment going on.
So they just repeat what she says and get they don't yell at her, but they just sort of yell the same thing she's yelling.
Right.
Okay.
They're like cradle walking down. I don't know if you noticed that I sort of kept it coming down, slowing down, still repeating the words and kind of the intensity.
Yeah.
There's one other thing I don't know if you guys have heard about, but deep breathing.
Yeah, I did notice that you were doing some breathing while you were doing that. Okay.
Maybe something like that.
Okay.
So who do you think we could get on board to try this?
I think definitely I have 2 staff members who are the day shift, who have really got it. I think I could.
You mean gotten the attack or got PPA down?
They've got PPA. I think they really believe in it, and so I think they've had a lot of success with a lot of the other residents.
Yeah.
So I think those might be my first 2 to try it with and see if they can even get in the room and just sit with her for a minute.
Yeah,
I don't think she'll want to talk or anything, but I wonder, maybe they can bring, I don't know, something for her to do, or
something to do, or maybe you can find out if there was something she enjoyed, like juice or a cookie, or
we could always put juice in a wine glass, and then maybe get like a stuffed dog or something.
Yeah.
To kind of hang out and sit with. That could be hers. We would leave it there, obviously, but.
Yeah.
Okay. All right. Yeah, I think I could try that with those 2 and see how it goes.
If it doesn't work, we can come back and rethink and look at some other options.
Okay. Yeah. Well, when why don't I try it tomorrow? Because things are just getting really dire. I'm really worried.
Yeah. Yeah.
We'll just see if we can get anybody in the room.
Yeah, getting somebody in the room sounds like just getting them in first to get that connection.
Okay.
It's really great that you all know PPA. I think that's going to really come in handy once you make a connection. That's that emotional connection. I get you.
Yeah, that's true. I guess we hadn't thought about the emotion part. We had only just been doing, most of our residents are pretty calm. So
Yeah.
this is really different. So, okay. Well, yeah, we can try that.
Check in with me after you've given this a try, and we can see how it's going, and if we need to talk about steps.
Yeah, definitely. I'm thinking probably 2 days is really all I want to let, because it's getting pretty bad, and she's been long enough that I'm really concerned.
Well, I really appreciate you being willing to try and come up with some ideas.
Yeah. Okay, cool. So, how'd that go?
At first I was struggling, but then I think it kind of, it was not smooth, but I think we got there.
Okay, so where did you feel like you had hang-ups or you had to take a pause, because you did do a couple timeouts for yourself that seemed to really work? Where did you start to get stuck?
Well, I think I identified a card at first that was probably a good one to go for, the stakeholders. And I guess I felt I had exhausted it and decided to hop around to other cards a little bit, and then went, no, I was on the right card. Go back. Okay. There's got to be more there. Because
so what did you do?
We can't get in the room. That is basically, if you can't get in the room, there's nothing you can do.
Right. So you were able to...
And those are the stakeholders.
That's right. And you were able to finally hear that biggest concern, even though I was saying lots of other concerns. You were able to offer me the choices of, do we think the care is most important right now, or health is most important, or getting connected? So that was a nice way to present it, because it made me realize, well, I can't get connected or I can't do any of that other stuff unless I get connected. So you did that in a nice way without giving me the answer, without sort of dangling it in front of me and saying, well, you have to do it this way. How did you feel about your cycle overall? Where did you spend really positive time?
I think I was good in the seeking.
Asking a lot of questions?
My reflecting maybe could have been a little better.
Okay, so you started out strong with reflecting.
Yeah.
For sure. Where did you feel like the reflecting didn't happen as much as you would have liked?
When I was getting stuck in my head.
Okay.
I sort of, in a way, stopped listening.
Okay.
When I was sort of going like, do I move on? Do I not? I sort of kind of I stopped kind of listening and reflecting back what you were saying.
Okay, so were you trying to problem solve, or were you just thinking too much?
I was just thinking too much. I was back in my head, like, I don't know, you could see me like peeking at the cards going, which one should I go to next? Because I think I got stuck. And so then I sort of lost my awareness of you. Okay,
so what brought you back? Because you were able to get back on track.
I think going back to that, just getting more and more with the stakeholders and because getting them connected, we identify the getting them connected, and I kind of forgot that for a couple minutes. And then we came back to that. I think we got into explore and a little better.
Yeah, so it kind of allowed you, and then your explore, that nice option, you gave me a couple choices here and there to kind of walk me through what the different options are that I could try.
Yeah, and the role playing, I think, was a good.
Yeah, that was an interesting.
Yeah.
How did that feel to recommend that as a choice? You did a nice job of reconnecting, because that's a different thing that you're asking me to do there.
Yeah.
You really get permission to do that.
Well, I think to me, it's something that I'm discovering is that, well, number one, role play can be really powerful, and someone having an experience. So I was aware I was doing a little bit of AELC there.
Yeah, I was
like, whoa, putting it together. But that's exactly what I was thinking. I was thinking, oh, maybe if she can just, and that this is another piece that I've taken away in the last few weeks. Could we just try? Could we just try?
Absolutely.
Is really helpful.
Yeah.
So bring it into the picture.
Absolutely. So you were able to kind of cycle in a little AELC and realizing that what we were missing, we had some skill, but we didn't have enough skill to deal with this situation. I wasn't able to find any way to connect. And if I can't get connected, then PPA, I'm not using it.
Yeah.
So how do I connect on the emotional level? So cool. So you were actually teaching a skill within the consulting cycle, which does happen sometimes because if I don't have enough knowledge. The interesting thing, you started to go into a little bit. What do you think about her type of dementia, or does she have a dementia? What were you thinking as you started to go down that road?
Well, I was thinking if you could figure out if you knew what type of dementia she had, you might be able to shift, if you know that she's...
What are you thinking? Do you have any ideas?
I was thinking Lewy body because of what I'd seen. I was definitely thinking Lewy body, which can account for outbursts and or delusions and,
And the lack of sleep.
And there might be other medical problems that have not been, if her blood sugar's low or too high.
Well, and yeah, we know she hasn't been taking medications that...
Right. So she might be outbursting from being in pain.
Mm-hmm.
So her medical conditions could be causing some of her changes in behavior. So that's why I was wondering if that might be a route to follow and find out.
Yeah. So when would that happen? Because I think you're absolutely right, but I think that we did the right thing for this person in this moment. Getting connected was most important first.
Mm-hmm.
So when we reconnected in 2 days, might that be a question to sort of throw out there? What do you guys know about Lewy body? Because a lot of what I'm hearing sounds a little bit like it could be connected to that. Would that be something to sort of throw in there once you've had that positive, hopefully positive trial?
Absolutely. Because I think we identified that there were the two major issues, and we picked the one, and if we can get that one, maybe of course we would look at an option. Do you think her health is something to explore more, or whatever, her not eating?
Right.
But then again, this is me just thinking ahead as, well, maybe her not eating is being affected by a health issue. So which do you think is more important,
Right. So, okay, cool. Did you successfully complete the cycle?
I think we did.
Yeah. Whose idea was it?
Yours.
It was. Very nice.
And I really like the fact that you thought about the wine glass. I didn't really steer you towards that, but I was hoping you would think of something like that. And the stuffed dog I already had in my head, but I was like, don't do it. I would have gone deeper if we didn't.
If we didn't.
But you did it. You got it. And people might just get it.
Yeah, absolutely. And it's clearly somebody who's tried a lot of different things. Even though I haven't really been involved, I'm clearly involved. So that was nice to figure out, not just leave it with me, but who am I going to try it with? So that was cool. Do you feel like I would be successful if I did it?
Yeah.
Yeah, I think so.
And it might take a few times and practice.
Yeah, absolutely. Cool. Okay, so your focus was staying curious and not suggesting things, and then using your tools, your puzzle pieces, your cheat sheet. How did that go? I
think it went pretty well, except, I think, I stumbled in the middle there somewhere.
Did you go to your go-to of suggesting things?
No, I didn't. I don't think I did. I think I stayed on track on that piece.
You knew when you were ready to do that. You were recognizing.
I stopped myself.
That's the first step, isn't it?
Just give me a second. I need to breathe for a minute, because my head started going, and I knew that I better.
But that's huge. That's showing that you're now recognizing the timeout, taking the timeout, and switching gears and being able. Did you use your tools then? What worked for you in those moments?
Well, the cards. I was just being able to look at them quickly and just evaluate what I was thinking I should do, because then that becomes suggesting. And I went, wait, hold on, go back to that card. And I pulled it up again, and I said, okay, there's some more here that I haven't explored.
Nice.
Because then it came down to the skills. Then at first you said, oh, they know PPA, they do it well. I was like, oh, well, those skills. And then I was like, wait a minute, there are deeper skills maybe. There are more skills then that's where the meeting at challenging behavior skills are different than just PPA.
Exactly. Nice. That's cool that your brain kind of finally got there. It takes some time to kind of realize that. And what are we missing? What are the skills that we're missing that are going to work here? Nice. Yeah. So you stayed curious. You used your tools. How'd your cheat sheet go? Did you find yourself using it?
Yeah, I did. Some.
Okay.
I used I wonder a lot, I think.
Mm-hmm. You did.
Have you heard? Those are the two that we really identified last week that I know I haven't. When I have them in front of me, what are you noticing I used? And the two, kind of trying to get which one of these do you think?
Yeah, offering those choices.
Yeah.
So where would you say, if you were going to set your goals for our last call, where would you say your biggest goal is for improvement? Do you want to stay in those two pieces, or is there a part of the cycle, or is there something else in this whole piece that you're kind of really hoping to master or practice?
I think I'm on the right track actually with these pieces. I think without the stumble, it would have been a fairly smooth and successful cycle.
And it was a fairly smooth and successful cycle.
Yeah, the stumbles, but I feel like I got myself onto a good track, and if that's working for me, I want to keep going with that instead of taking up the cart, because this was working.
So your one piece that you said originally when we just finished the cycle was the seek was really strong, but the reflect was where you noticed things were starting to go, ooh, I'm not reflecting.
I wasn't echoing back quite as much as I could have.
So should we set that as your goal, or do you have something else that you feel like is a bigger?
No, I think really staying with something that I trusted my gut and went with the stakeholders, but really staying with that
rather than just moving on, trying to gather as much.
Right. If it was kind of working, and then when it kind of didn't seem like it was, I didn't go deeper at first.
So feeling comfortable digging a little bit deeper into something when you got the surface content.
And then it was just like, bam.
Check.
Yeah. And then it was like a roadblock, but we eventually did get off the roadblock of I just can't get in the room.
So not just glossing over all the little puzzle pieces, but actually when you really want to know something, how do I stay in it and dig deeper without it feeling like an intrusion?
Right.
And using that reflection to really kind of start to pick it apart a little bit without it feeling like, well, I don't know. You weren't getting any of that kind of response. So it was okay to stay there in the moment.
Yeah.
Nice. Okay, cool.
Pretty good.
Yeah, pretty good. Good job.
Thank you.
All right. Well, any questions or anything? We have one more call where we'll do a scenario that you choose and set up.
Again, a scenario that I choose?
Mm-hmm. So we won't do one from the book.
Okay.
It'll be one from your life or your past or something that you've struggled with, and we'll try it out and we'll see if you can get it to go differently, or if you can prep yourself for the future, whether you want to do one that's coming up or one that you've already done, to see, could I get somewhere different with it if I tried it with this cycle?
So if maybe I can plan my call with Kiki, see how that goes.
Yeah.
And if it feels like it might be helpful to revisit in a role play situation.
Perfect. And if you want to use that as your PPA,
if it's a phone call, just the
you still use PPA on the phone call? So that would work just fine if you wanted to use that as your show of how am I doing PPA.
Okay.
So if you want to send me that recording even just the first few minutes of it, if that's easy, or you can send the whole thing and just tell me, listen to the first 3 minutes. I was really working to connect with her, trying to do X, Y, or Z.
Okay.
And then I won't listen to the whole call because then that'll kind of change what I'm thinking as well.
Yeah.
But
Yeah.
but you can kind of set up the scenario for me the next time in the next call, and then we'll be done.
Could I even just send you the email she sent me?
Yeah, sure.
Because that's what I'm walking into it with.
Perfect. Yeah, let's do that.
All right, perfect.
Okay, cool. So time-wise, you want to get set up with her before you get set up with me, right?
Yeah.
So I'm going to go ahead and stop recording because we're just going to do